I bet no orthodontics aficionado would want you to get hold of this cheat sheet for orthodontic treatment. We studied Scamon's growth curve in first chapter. Little did we know that this is more than just curves. Scamon's growth curve has more to tell us. We get these questions where we are given angle SNA value, angle SNB value, and patient age, and we have to devise the treatment plan for the same. And the answer for that lies in this video. So let's delve into this. Scamon's growth curve tells us that different organs grow at different rates. When it comes to maxilla, it follows neural growth curve. The maxilla, it grows earlier in life compared to mandible, that is at 6 to 8 years of age, and its growth ceases earlier. Thus, the growth modification appliances they are given earlier in life to maxilla compared to mandible. The growth modification appliances are orthopedic or myofunctional appliances, and they are usually given during the mixed dentition period or adolescent growth spurt. The growth modulation of maxilla it should be carried out earlier comparatively. Whereas mandible follows general growth pattern. Growth modification it should be extended until its growth ceases. Mandible growth occurs until 18 to 20 years in males. So the devices should be kept until the growth of mandible ceases or stops in order to prevent relapse. To conclude, on the left side, if the SNA angle is more, that is maxilla is excess, or SNA angle is less, that is maxilla is deficient, it is important to start growth modification at a younger age, that is at 6 to 8 years of age. In other case, on the right side scenario, if angle SNB is more, that is mandible is excess, or SNB is less, that is mandible is less or deficient, growth of modulation of mandible, it should be extended until the growth of it stops or ceases, that is at 18 to 20 years of age. Because if this growth modification or the appliance that is attached at mandible is removed abruptly or before the growth ceases, that it will continue to grow and cause relapse of the treatment, that is develop class 3. In simpler words, the treatment for maxilla should be started at the earliest because its growth ceases earlier compared to mandible, whereas the growth of mandible continues until 18 to 20 years of age. Hence, the treatment of mandible should not be abruptly terminated until the growth stops or ceases. Growth modification, that is either orthopedic or myofunctional appliances, they should be given during the mixed dentition period or adolescent growth spurt, but earlier in maxilla, that is 6 to 8 years of age. Even rapid maxillary expansion is given during adolescent growth spurts. If the age of the patient mentioned in the question has crossed the growth spurts, then orthodontic surgery is performed when the growth ceases, because surgery is performed to make this treatment stable. We want the results to be stable. Hence, the growth should cease or stop. Then, after you have written all the treatment plan, you must write this point that after every treatment, fixed orthodontic therapy is a must because this prevents relapse. Relapse will occur in every case, so we need to give fixed orthodontic therapy like braces or retainers in order to keep our results stable. I'll also make a video on case scenarios, orthodontic treatment options for different cases. Until then, take care and happy studying.